Okay, Commissioner, here we are for our weekly video, and to our Sunday night viewing audience and our Breakfast Club folks, we haven't seen you in a couple weeks.
We missed you.
Yes.
And we didn't do a listening tour this weekend. I feel like I'm out of touch and I haven't been able to really see people on their little team squares.
Yep. So we've made the decision that our weekly videos and memos will now come out every other week instead of weekly. Did you want to advise staff of the messaging there and kind of our thought process?
Yeah, just like everything with this pandemic, we've had to think about the cadence of things. We want to make sure that we're using the best use of your time, giving you information that will help you make some decisions in that kind of work-life balance. And, we're just finding that every week might have been too much. And so we'll scale back to every 2 weeks. And then if the need arises, we can always, bump it back up to every week or even more frequently if we have to. And that, just reminds me of suggesting to people, watch the governor's briefings. He provides every few days some really good information. And if you haven't had a chance to look at those, it really helps you kind of set the stage of everything that's happening across Connecticut as it relates to COVID. So he does a good job. Watch them, take a look.
I think it's on about 4 o'clock every day on television, and then certainly that's covered in the media. Mm-hmm. Commissioner, this week we had our Leadership Academy for Middle Managers, the LAM kickoff, where you gave opening remarks. And I'm going to get tongue-tied saying this, but you are a LAM alum.
I am a LAM alum.
LAM alum.
I am. And, shout out to, this was kind of birthed out of Deputy Commissioner Jody Hill-Lilly used to be on the faculty for the National Child Welfare Workforce Institute, who had the original curriculum of LAM. They've now repurposed it to have a Connecticut version of that. And Tracy Davis, as the Academy Director, along with the folks down at the Academy for Workforce Development, have kicked off the most latest cohort of Leadership Academy for Middle Managers, and that has created this common language of across leadership of the department. And each of the participants do a change initiative, and many of those get lifted up and they get kind of actually put into practice across the department if there's something that really can take shape. So I'm excited to see what they come out of it. Mine had to do with, when I was in LAM, lifting up differential response across all of our agency, across the agency and all of the offices at the same time. And
look at that. Right. And rumor has it there's a little competition between the super coaches. So we had some spirited discussions about who's going to overtake Deputy Commissioner Michael Williams' throne here. So there's a lot of work going on behind the scenes there, which, Commissioners, actually is a nice segue to the next piece that we wanted to inform staff is a lot of our work has received national attention, and you gave opening remarks at the National Child Welfare League of America conference over the past couple weeks. Experience like?
Oh my gosh, Ken. Yeah, CWLA asked us to provide some opening remarks because we had done a webinar, Director of Multicultural Affairs and the leadership of our statewide racial justice work group had done a mini webinar in anticipation of the summit, and it got such positive reviews. I was asked to come and give some opening remarks during the CWLA annual conference. That was such an honor. They're celebrating 100 years, and anytime I get to talk about the tremendous work of the department, just count me in, because like I said, I'm really proud of the work that we do here, and I can't wait to talk to other people about it. And then that led us to yet another time to be able to brag about the work that we do. Deputy Commissioner Michael Williams and I did a congregate care placement practice sustainability webinar for some jurisdictions across the country as it relates to child welfare and juvenile justice. And it was just this conversation about decreasing the over-reliance on group care and congregate settings and increasing kinship care and having kids in family settings. And we know that in Connecticut, that's the way we live and breathe, you know, looking at maternal and paternal family members as a part of our practice that has sustained a huge culture shift over the last 10 or so years. And we were excited to be able to talk to them about, you know, how we've been able to sustain that even through till today. So, you know, I just love being able to talk about our work and share it with other jurisdictions.
And then you and I today were with our partners from the Children's League of Connecticut, along with Governor Lamont, to have a press conference that to be very clear and simple, was to celebrate the unsung heroes of the pandemic. And what a lot of fun we had today.
Yeah, you know, this was sponsored by CLOC, or the Children's League of Connecticut, and that's 11 member agencies who have worked with us throughout the pandemic to really make sure that our private nonprofits, our, you know, therapeutic group homes, the residential facilities that we still have in Connecticut that have kind of been in that 24/7 trenches, you know, like our Solnits, like our Caroline, like our essential staff who have been still conducting those face-to-face visits throughout the last 7 months. It was, you know, the things that people have had to sacrifice over that time, you know, in terms of their own health and safety, to make sure that our kids have what they need. And so today's press conference was an opportunity to just say thank you to those kind of behind the scenes heroes that sometimes don't get that kind of recognition. So it was really, really nice. And in the press conference was a foster mom from Waterford Country School. And she was a therapeutic foster mom talking about, you know, the impact of, you know, what this has done to our foster care system in terms of foster parents kind of now having to be caregiver, teacher, playmate, tutor, all of those things as it relates to really trying to navigate the pandemic. And it was really nice to kind of have her there talking as well.
Yeah. So a great individual to meet, and we got to meet one of her little daughters that she's going to adopt hopefully within the next month or so. And to see that little girl's face beaming and wanting to tell us all about her little world was really priceless. So that was a great time today. And I think it's a refresher as well, especially because, middle of October now, we're in the pandemic 7+ months.
Oh, yeah, I did want to say that a little bit of a teaser here is that we were able to get a little bit of a bump up in the rate for our foster parents for a couple of months as they prepare to navigate back to school, hybrid school, remote school, you know, all those different things that we know have challenged our foster parents that we were able to get kind of through the CARES Act money. So excited about that. You'll hear some more details as that comes through OPM, but that's coming as well. And so that brings up the fact that the last 7 months has been 7.5 months now have just kind of turned our world upside down, and that we have just been plugging away. And, you know, DCF is one of those agencies who never shut. You know, it's really humbling to think about all the stuff that, you know, our staff have had to go through during this time.
And I think, Commissioner, as well, you wanted to really send a message as well to staff that we really need to be utilizing our supervisors, that when we are not able to complete a task, when we are believed that we're overwhelmed, when something is uncovered, especially now is the time to continue to develop those relationships and ask for help and support.
That's right. You know, we've talked about and mentioned that safe and sound culture, and that is that ability to kind of create this environment to talk about how this pandemic is wearing on us, how the stress of the job itself is impacting our ability to kind of have clarity in the job that we do. Our job is mission critical. Make no mistake. You know, the work that we do with kids and families and keeping kids safe is our mission. And, you know, you want to make sure that COVID fatigue doesn't set in. And if it does, having those conversations with your supervisor, with, you know, calling EAP and you know, the support that they can give to just help us figure out what's going on. If things are getting a little heavy, or if you just are trying to sort some stuff out, it's an opportunity now to really talk about the quality of our work and the fact that we can't lose focus despite how long this pandemic response has gone on.
Absolutely. So typically at this point in our video, we advise the staff if they do not want to hear the most updated statistics, by all means, they can turn their cameras off. So it would be a good idea to do that right now.
As you know, as we're recognizing the fact that, you know, the last 7.5 months have been somewhat of a marathon, and, you know, really that's work-life balance, doing things for your own personal well-being, those kinds of things are going to help us stay in it for the long haul, because we don't know when the end is. So, take care of yourself. We're going to switch over to conversation right now about the stats, but just wanted to, highlight the fact that this is a long time, and, we're in it with each other, and we're just going to have to navigate things together.
Absolutely. Absolutely. So the most updated statistics as of today are that we have had 101 caregivers, 50 of our youth in care, and 55 staff that at some point have tested positive for COVID-19.
Yeah, Ken, so if you could share your screen, I want to share just a visual related to our positives. And, not yet, here it is. Here it is. One of the things that when I just talked about the governor's briefings that they released this week, that was that notion of where in the state, a color-coded response of where the transmission rate is kind of ticking up based on the number of positive cases per 100,000 each day. And so there is an updated daily map of Connecticut that tells you town by town where the towns in Connecticut fall within that red, yellow, or orange category. Yellow being that kind of 5 to 9 cases per 100,000, and the red, of course, being those cases where they issue a public health alert. And I just want to highlight that, because in the state, today's briefing talked about another 802 positive cases since yesterday, which is a tremendous bump up from what it typically is. So we are definitely seeing an uptick. Our state itself is very well prepared for what these surges will look like. And, we're much better shape than we were back in March. But I want to make sure that you are very attuned to what's happening geographically the state, and we can govern ourselves accordingly, remembering to mask up, remembering to our hand hygiene and social distancing can't be more important now than ever. Ken, if you can scroll down a little bit, I can show you also a chart of our staff positives. The shout out to Jadi EJ, who's back from her maternity leave, who had started to crunch some of these numbers and give us a visual of just what things have been looking like from an illustration here. So what you're seeing in front of you are the 55 staff positives that Ken just talked about as it relates to the last 7 months. So if you look back at what we now know was the peak in Connecticut back in April, that it comports with what we have and what we show as when we had our highest number of staff positives. When you look back to October, when you kind of scroll down now to October, we do see now that we are up to the point at which we were at the end of September last month. And so right now we're about halfway through October, and we're already kind of at that point where we were at the end of last month. So, as we start to pay attention to what things look like over time, we can start to really, focus in and hone in on how this is impacting our workforce and how it's impacting the foster families as well as the kids that we serve. And we thought these visuals, the red, yellow, and orange coding, as well as the trending over time of what our staff positives have looked like, would be a good addition for today's this week's data representation.
Absolutely. So we'll stop sharing that right now. I think that concludes the topics that we wanted to talk about this week. We will certainly see staff in a couple weeks. And again, if individuals have ideas or topics or questions, we still have the COVID-19 mailbox. We're still very willing to elicit and respond to any input that we have. So.
Yeah, you guys, we got this together.
We do. Thank you, Commissioner.
All right.